Excellent, Sandra. So I just have this one last slide to kind of drive home the point of what we're doing here. So again, uterine fibroembolization, our goal is to cut off the blood supply to the fibroids, protect the rest of the uterus, and relieve the symptoms that are associated with fibroids, such as bleeding, pain, and pressure. So here, this is an MRI image of a uterine fibroid before the procedure. It's a very, this brightness that's associated with the fibroid, that's all the blood supply that's getting to the fibroids. And it's, again, you can see that it's large, it's pressing down on the bladder, it's pressing down on the bowels. So a lot of women also have constipation. They have trouble having bowel movements because it's hard to, given the size of the fibroids, it's hard to have a bowel movement. This is 3 months after the procedure. The vascular supply is gone. The fibroid is essentially starved for blood, so it's shrinking, and then continues to shrink 6 months after the procedure. And essentially, this will shrink to a pea size, to the point that it has no clinical effect on the body anymore. So I think that's my last slide. Hopefully that explains a little bit of what the procedure involves and what to expect.
I think you explained a lot, Dr. Amit. We do have questions. And first of all, let me just say thank you. That was very informative. And a lot of times, we keep talking about the fibroids, or we've been told we have fibroids, but we never see that. We never see what it looks like and what can be done. So I thank you both so very much for today. So now we're going to go to our question and answer segment. And let me just check in and see what we have. So our first question, and this is, it says, are treatment options limited if I have a large fibroid over 12 centimeters, or with additional 3 fibroids in my uterus the size of a 16-week-old pregnancy, and they have very painful symptoms?
I can take that. Not at all. That she's still a candidate. We always check all the other things around it, such as that there's no cancer or anything like that. But yes, I've treated, and so has Dr. Ahmed, patients who've had fibroids the size of a full-grown baby, all the way up almost to the xiphisternum in the chest. So she's a candidate without a doubt.
Perfect. Okay, so the next one is also similar to that. Is it possible for fibroids to be too large for this procedure?
It's the same answer,
Okay.
almost never. The only one that we are usually very careful of is sometimes the fibroid can kind of come outside of the uterus. Dr. Ahmed, if you could share that slide that shows the different types of fibroids at some point.
Absolutely. Let me pull that up for you, Dr. Chopra, so that you can see.
So what happens is the fibroid will grow within the muscle, and it can be either inside, as Dr. Ahmed is showing you. The one that we usually are a little careful about is the one that's called the pedunculated subserosal, where it's outside the uterus. That's really rare, and we do an MRI so we can find that out. And what we look for is that little stalk, that little neck. If it's too thin, then we worry that it may break away, but those are rare. So almost no size is excluded. And the best part of this is, let's say we treat it, the failure rate is very, very low. You can still always have that hysterectomy, but that hysterectomy should not be the first choice. And I've done several hundred of these. I've not had to send one to hysterectomy just yet.
Perfect. All right, so here's our next question, gentlemen. Are there any natural ways to shrink fibroids or prevent the growth of a fibroid?
There is really none. There's a lot of material. I'm spiritual at heart. I call myself a humanist. And holistic means you incorporate everything from diet. So what I would say is there's no kind of magic pill for this, but leading a healthy life, good diet, all that stuff is good. But there really isn't some kind of magic pill to stop it. I'll let Dr. Emma chime in if he has some thoughts on that.
Yeah, I think Dr. Chopra, kind of hit the nail on the head. A lot of women sometimes feel that did they do something to cause these fibroids to grow? Is there something that there's in their diet? Is there something in the medications that they're taking? And the answer to that, is usually no. A lot of this is genetic. That's why, a lot of African American women have fibroids because it runs in families, grandmothers, mothers, daughters, and then their children have it. So there aren't really any, proven natural ways to reduce or shrink fibroids or prevent the growth of fibroids, unfortunately. But again, there's good treatment options out there.
All right, thank you for that. So here's our next question. She asked, if I had a myomectomy, can I still get the procedure? My fibroids are back.
Absolutely. I'm sorry, go ahead, Dr. Ford.
We both said the same thing at the same time. Go ahead, Samir.
Yeah.
Sure. So yes, absolutely. So if let's say if you're younger and you had fibroids and at that point you didn't know about fibroid embolization, for example, and you went and had a myomectomy done. Now the fibroids are back. You still have the option, the same options available on the table. So again, you can get a hysterectomy, myomectomy, or uterine fibroid embolization. Again, the fibroid embolization is a procedure that doesn't take away any future options, and it also is not affected by any prior treatments, such as a myomectomy. So I would say yes, absolutely. I actually had a patient not too long ago, probably about 2 weeks ago, that had the exact same, was in the same boat. She was young when she had the myomectomy done, and they had come back over the next 10 years, and now she wanted a less invasive option, and she had a fibroid embolization done. She's had good results from that so far.
Okay, perfect. So here's another question about a lot of fibroids. So this attendee asks, so what if I have a lot of fibroids, over 20 fibroids? How will this work?
It's the same. The analogy that we often use is that of a garden in your weeds. Whether you have one or you have 100 weeds, you'll spray the whole garden. So that's what we do here. And we found multiple small ones or one big one, they are still effective. Samir, feel free to chime in if you think, Dr. Ahmed, there's something else to add.
Yeah, no, I think you made an excellent point. I think, if you compare it to a myomectomy is a procedure where you can't target all the fibroids. With fibroid embolization, we target every single fibroid. So the way that the procedure is done, it allows us to get rid of all the fibroids that are present, whether it's 20, 30, or 1.
Perfect. So now the next question, can the fibroids grow back even after having this procedure?
The ones that are already necrosed and they are dead, they're gone, those don't come back. Can you develop some new ones? Yes. But like I said, I've done hundreds of these. I've been doing this over 2 decades. And we don't see that at all. Theoretically, if it's not done properly, there's a small chance. So to explain this, the uterus can get blood supply from the right and the left. And if somebody is not careful in doing it and only does one side but doesn't do the other side well, or there's another blood supply feeding it, so that way it's an incomplete procedure. In those cases, it can come back. And Dr. Ahmed, if you could share that slide that shows the blood flow, maybe it'll be a good visual for folks to understand what I'm saying. So done correctly, it doesn't come back because that plant is dead, that fibroid is dead. But if it is for some reason incomplete, or there's blood flow from somewhere else, as you'll see, Dr. Ahmed is showing the artery on the right and the left, and then we hit the whole uterus, so all the fibroids get treated. And if for some reason from one side it's incomplete, then that becomes a problem. But like I said, if 99% of people have zero problems with it, so they don't come back.
Yeah, the one thing that I'll add is in the literature, the success rate for this procedure is 98%. And that's not just it's not, that success rate is not based on just imaging findings, meaning it's not based on a large fibroid becoming small. That 98% is actually from clinical response. So how 98% of women see a very significant improvement in their symptoms, which is the most important thing that we're treating, obviously.
You know, I like to follow these patients for life.
Okay.
Get to know the human being. I've had patients I did 18 years ago, I still find. And I've done this on friends, family, gynecologists as well, gynecologist family as well, and they've done all very well.
Well, ladies, you heard that. It's 98% successful, and you get a doctor for life, okay? Here's our next question. Has the UFE procedure ever been performed on a kidney transplant patient? And if so, is there dye used during this procedure?
Yes, so we use this agent called contrast. It has iodine that the kidney filters out. So if somebody has had a transplant and the kidneys are working well, then yes, we can do it. We use contrast, but we use a very small amount, very, very small amount, not enough to hurt the kidney. And so answer is yes, can be done. You just have to be careful.
Okay, very good. Okay, so this person asks, she says, this is great. I'm loving it. And then she goes, why aren't doctors told about this? And then the final question she's asking is this really safe?
Oh, it's very, very safe. Like we said, you know, if in 2003 Condoleezza Rice could have it, why is it that 20 years later, 17 years later, we're still not talking about it? See, there's a lot of noise. So if there's a lot of noise out there, you don't hear the good music. And there are a lot of forces differently. The commonest thing, as Dr. Ahmed said earlier, why don't a lot of women know about this? Because you see, it's a one and done. You have a fibroid, I treat it, you're fine. So we count on other women to teach other people. That's why we do these kind of talks, that there are safer options out there. Most women, when they have a problem like this, go to a gynecologist.
Mm-hmm.
I have gynecologists as friends, but they do not do this procedure. It's not part of their training. They do myomectomies, hysterectomies. They are used to it. To them, it's a piece of cake. They say, yeah, just have a hysterectomy. Oh, just have a myomectomy. And that's part of the problem. So we've made it a mission to get out there. We've actually just started a not-for-profit organization as well called Sangat Seva, which one of their mission is to provide this kind of education, help patients who don't have the resources for this treatment. But we want our patients to live their best life. And if you've had a hysterectomy, if you have all these challenges, how can you, live your best life? So with that in mind, we've been kind of making sure there's a lot of awareness. But I ask each and every woman who knows about this to tell 10 other people, get on social media, tell your sisters, tell your friends. Listen, we talk about so much other stuff. This is important. You don't need an unnecessary hysterectomy or myomectomy. That's the way to do it.
Okay. So we just have, I think, about 5 more questions for you. These ladies are really active today, and thank you so much for sharing, gentlemen.